Hi everyone, it's Dr. Sarah, and today we're going to be talking to Dr. Shane Connor. He is an oral surgeon with Oral and Maxillofacial Surgery Associates, or also known as OMSA. So thank you, Dr. Shane, for joining us today.
So like she said, my name's Shane Connor, and I'm an oral and maxillofacial surgeon. I am one of 7 oral surgeons in a group, as you said, is called the Oral and Maxillofacial Surgery Associates, or OMSA or OMSA, because that's quite a mouthful. We are a group that has 5 offices, and we serve patients throughout southeastern Wisconsin.
And your closest location is here in Slinger?
It's in Slinger, Wisconsin, where I am currently.
Perfect.
Yeah.
So tell me a little more about your scope of dentistry out of your office.
Yeah, sure. So because we're in such a large group with 7 of us, we're able to provide the full scope of treatments that an oral surgeon can offer. So some of those procedures are wisdom teeth removal, routine extractions, dental implant placement, and bone grafting. We also provide treatment of the temporomandibular joint, or it's commonly known as the TMJ. We do pathology, and we also do corrective jaw surgery.
That's a lot to do. Very nice. I think our primary referral over to your office is implant consultation. So could you walk our patients through that appointment?
Sure. So first off, thank you for referring your patients to our office. We really appreciate you kind of giving us your trust in providing care to your patients. So a typical implant consultation in our office will take around 30 minutes. So during that appointment, we're going to review with the patient their chief complaint. We're going to go over their medical history, medications, allergies, that kind of stuff. And then we're going to do a thorough clinical head and neck examination, where we also kind of review any dental x-rays that have been sent over, and occasionally we take some of our own. So after we've got all that data, we're going to kind of develop a treatment plan. We're going to go over different options. We're also going to discuss what implants are, how they work, and that kind of thing, because that's usually pretty new to patients. Once a treatment plan has been kind of developed and decided upon, we also go over different types of anesthesia that we can offer the patient, anything from just numbing that site up to all the way to going to sleep, like an IV sedation.
Now, do you do IV sedation at your Slinger office?
We do. We provide that at all of our offices. And because we are oral surgeons, we're all trained in being able to provide that level of anesthesia.
That's great. So then after your consultation, that next appointment then would be whatever you discussed at that treatment planning session.
Yeah, that's right. So implant placement typically is done in one of 2 ways. So either it's done immediately following the extraction on that same day, if the conditions are ideal, or the tooth is extracted and then the site is allowed to heal for several months, and then you come back and place the implant. In our office, typically implants are placed immediately, and there's several advantages to that. First is that it's kind of one procedure, one time to go through getting numbed up and healing up. And then the other advantage is that you kind of get to the finish line or to the end goal a little sooner, which is obviously getting a tooth on there for you to be able to chew with. And so after an implant goes in, we allow it to heal for a couple of months. And then once we've found that it's healed, we send them back to your office to get a crown put on it.
That was exactly my next question for you, is how long is the typical integration time? And it's usually around 3 months.
Yeah.
I've been seeing.
Yeah, I usually ballpark for patients 2 to 3 months, and a little bit that depends on how the implant goes in, but for the most part, everyone, 90% of people fit into that.
Great. Well, a common question that patients come and ask me during these appointments where we're discussing implants as an option is, how much is this going to hurt? So can you please ease my patients' minds with this common concern?
Certainly. So it is not uncommon to have that type of concern, and a lot of people during the consultation bring up that. So what I'll tell you is that when dealing with implants, a lot of that concern comes from the fear of the unknown. And I'll tell you that the vast majority of patients in our office are able to go back to work the following day after the procedure with little to no restrictions in what they're doing. Generally speaking, they're taking over-the-counter Tylenol and ibuprofen for any discomfort they have, if they're taking anything. Implants typically, like I said, are placed immediately following an extraction in our office. And the extraction part is where they're going to get some of that discomfort. And that's usually a more kind of understanding that a patient has than the implant placement. Implants really don't add any kind of additional discomfort to the overall procedure.
I do have to say that our patients that are already missing an existing tooth and go in for this procedure say it was easier than a filling appointment.
Yeah, that's pretty common for them to come in and say that the whole process was a lot easier than they had thought it would be, and that they had very little to no discomfort following the procedure.
Well, thank you so much, Dr. Shane, for joining me today. It is always a pleasure speaking with you, and I think my patients are truly going to appreciate this information.
Well, thank you so much for having me on, and I look forward to working with you more.
Thank you, Shane.
All right, bye-bye.
Bye.